Hi there, my name's Sophie. I'm a wildlife vet and a previous MSc student in wild animal health, and I'd like to talk to you about my MSc thesis project, which was funded by the Animal Welfare Foundation. So my study it is on elephant endotheliotropic herpesvirus, or EEHV. Now this virus circulates in elephants, both African and Asian, but I focused here on Asian elephants because EEHV is a leading cause of mortality in these animals in captivity, and it causes this really nasty hemorrhagic disease in juveniles and calves, which is a considerable welfare concern. It's also present in free-living animals, and it's been found on post-mortem examination. But unfortunately, we're currently only able to detect this virus using invasive sampling types. So, for example, swabs of saliva, blood samples, and swabs of the ocular surface, things like that. And for this reason, not much study has been possible in the wild. So the aims of my study were to determine whether faecal detection of EEHV 1 and 4 is possible for Asian elephants, which are confirmed to be shedding the virus in saliva. So effectively, I wanted to look for a non-invasive way of detecting this virus, so that in future we may be able to go out and study free-living populations of elephants to learn more about this virus and the impact that it has in the wild, and whether we can use this to help the captive situation, given that it's such a problem. So how did I do this? So I collected paired samples of saliva and faeces from 5 captive Asian elephants in Thailand, which were between 3 and 10 years old. So 4 of these had been previously identified as shedders of EEHV 1 or 4, which means that they had tested positive previously on saliva sample, and one of the elephants was negative and it had never tested positive before. So the aim of doing this was to try to find elephants that were shedding in saliva and to see whether at the same occasion we could find the virus in faeces. So these samples were taken from the northern part of Thailand, which you can see in green on the map, in the Chiang Mai region, which is where the highest number of captive Asian elephants resides. So after we had collected the samples, we stored them in a -20-degree freezer, and then during the lab work phase we moved on to DNA extraction first, and after we had extracted the DNA from the saliva and fecal samples, we tested them with PCR for Asian elephant tumour necrosis factor alpha, and this was to determine whether or not we had been able to successfully extract elephant DNA from the fecal samples in particular, but also the saliva samples. And if we had, we used this as a proxy for the possibility of detecting EEHV. And these positive samples moved on to EEHV PCR. However, if we weren't able to detect TNF alpha, we re-extracted the samples, and then anything that we had tested and came out positive for EEHV 1 or 4 progressed to gel electrophoresis and then sequencing for confirmation. So this table shows our results from the study. So each of these letters across the top, B, B, H, N, NP, etc., represents an elephant in the study. And you can see that we have the date here of the sample, each date that the sample is collected, and then we have a saliva result and a fecal result, and highlighted in yellow are the positive results. So you can see that from 3 different elephants we detected EEHV, and so 2 of these we detected EEHV in 4 in saliva, and on 1 NP we detected EEHV1 in saliva. And the interesting thing is that we detected EEHV4 on 2 separate occasions in 2 separate elephants in faeces at the same time as they were shedding in saliva. So it is possible to detect EEHV4 in fecal samples, but there are some issues with this, and it's not always possible when the elephant's shedding in saliva. And this could be due to true differences in shedding patterns or limitations of our study, which is possibly the more likely option. But if we can improve this method, there could be benefits for both free-living elephants and captive elephants in the future. So I'd like to thank all of the staff at the RVC that helped me, and those from the University of Chiang Mai in Thailand, as well as the Animal Welfare Foundation. So thank you for that. Any questions?